So next up is Alex Wilson. She's a senior physician assistant in our Pediatric Orthopaedic department here at UCSF. She completed her master's in public health at Boston University and her MS in physician assistant studies at UC Davis. She has special interest in pediatric spine and hip conditions and is a great teacher. We're excited for her to share today on the topic of caring for infants in a Pavlik harness or Rhino hip abduction brace. Welcome, Alex.
Okay, hi everyone. Thank you, Dr. Watkins. So I'll talk to you guys today about caring for infants in Pavlik harnesses and some of our older children in Rhino abduction braces. I have no financial disclosures. We'll go over both the types, the harness and the brace, and what they look like and how we put them on. We'll talk about a little bit of a review of what Dr. Swarup already mentioned when we are indicated to use these devices. And then we'll talk about just care considerations, a lot about what we counsel families when we're starting these Pavlik harnesses or these braces. Some of the complications, which were a little bit discussed already, but we'll go over those and a couple others. And at the end, I'll kind of share with you the resources that we give to families when we are counseling them and they're starting out using a Pavlik harness or an abduction brace. So the two types of things we use most commonly in our clinic are the Pavlik harness and the Rhino abduction brace. The Pavlik harness is a soft dynamic brace that allows kids to move. This is typically used in kids who are 6 months old or younger. And typically it's for hip dysplasia. There is one other use we use it for that you may see kids in your clinic for. Those are little babies who have had femur fractures and are under 6 months and can't be casted. The Rhino abduction brace is rigid and fixed, so it doesn't allow as much movement. And it's typically used for patients who are 6 months or older. But there are some indications where we use it in younger kids. Dr. Swarup had mentioned where we have kind of had failure of our Pavlik harness. A little bit of a review again, but our exam findings, which we'll do in the workshop, are typically looking for our positive Barlow and Ortolani, asymmetric hip abduction, and one knee being higher than the other when we see our Galeazzi sign, that being positive. He already went over what we look on for the ultrasound, but essentially we typically get this between 4 and 6 weeks, and with a combination of these findings, if we see that there is hip dysplasia in any of that spectrum, we consider using this Pavlik harness. So a couple things we tell families, like not all of our babies are this happy in our Pavlik harness, so there's a lot of counseling that goes in, especially that very first visit. And one of the biggest things before we put the Pavlik on, we ask families to use just a very thin bodysuit or onesie that essentially has no legs. So those legs are naked inside the harness, and there's just a snap over the diaper. This allows the harness to fit best on the patient, and this is how we initially make it fit and kind of mark the straps where we want them. A lot of families will ask about strap covers or knee socks. The strap covers, you can see a picture of them on the right side of your screen where the little rainbows are on those cloths. Those can go over the straps. They're absolutely unnecessary, but a lot of families do use them, and you may see them in your clinic. They do kind of serve two purposes. One is they keep the harness a lot cleaner. A lot of families get worried about the harness getting dirty, and as you all know, seeing babies and having some of your own, they're going to get dirty no matter what you do. So some families do like these. They also serve the purpose of kind of protecting their skin from the straps resting directly on their neck and in the areas where they don't have clothing. In the colder months, a lot of families get worried about their kid being cold if they're told, like, please keep your legs naked. And so there are these like very cute baby knee-high socks you can just order on Amazon. So some families will use these, and they're thin enough that they allow the harness to still fit properly. Dr. Swarup had also mentioned some of these sleep sacks. So a lot of families have, by the time their baby's about 4 to 6 weeks, they've already gotten in a routine of doing some swaddling or having them in a certain way that they sleep at night, that they feel like they've been successful. And so they'll ask about how do we continue that using this harness. There are many, many sleep sacks out there that are made to accommodate both the harness and the abduction brace. You can see this little girl with her little bunny, like she's probably in a Rhino because it's very, very wide, but the sleep sack still covers it. So there's many options out there for families to use. A lot of parents will also say, I swaddle my baby, is that okay? I think we all kind of know at this point swaddling the arms is fine, but we always, even in babies who don't have hip dysplasia, want to keep those legs open and apart. And in the harness, they need to be able to fall open easily in that abducted position we've set them in. So they can certainly swaddle the arms, that's absolutely fine, as long as those legs can stay open. There's one here where you can see the baby has his arms down in a swaddle that just covers the arms, and then there's also swaddles out there that are made that keep the arms down but also have a cover on the bottom that's very, very wide. So there's many options out there. Another thing we talk about is just checking the skin. They're going to be in this Pavlik sometimes 23 to 24 hours a day. So we do ask the families, every so often, maybe every diaper change, just check around the areas where the brace or the harness is coming into contact with the skin, make sure it's not irritated. And then looking kind of where those skin folds are. So the knees are bent in a 90-degree position. So just checking back there and making sure there's not any irritation developing. A lot of families take off this harness if they're in it about 23 hours a day, their hips are stable. We often let them out of that harness about an hour a day where they can take a bath, take pictures of their kid without the harness on. This is another time they can check kind of all of those skin folds in all of those areas for any rash that's developing. Like I said before, it's going to get dirty, so many families are tempted to put this in the washing machine and clean it, but we really advise them not to do that. One is if it goes in the washing machine, then it's kind of hanging up all day to dry, and they're out of it for an entire day, which we don't want. If they throw it in the dryer, it's just going to shrink, right? And the Velcro essentially will fail. So we really remind families just spot clean only. It's going to get gross, but we can always give them a new one if it's beyond repair, but just spot cleaning only for the harness. Diapers, luckily the harness is made that you actually don't have to do anything to the harness to change a diaper. So there's a nice wide opening. You can kind of see this provider is showing how to change a diaper with the harness on. And the legs are open, there's nothing covering the diaper, so that can be changed easily. One thing we tell families, and if they've had other kids or have taken care of kids in the past where they kind of grab the legs, pull it up, shove the diaper under and change them, we kind of advise against that because we want to avoid anything where the knees are essentially coming together. So just like you would take care of a patient with clubfoot, you're kind of gently lifting their bottom to change the diaper rather than grabbing the legs in the harness. A lot of families too will ask, I've been breastfeeding or I'm bottle feeding, how do I hold my baby now that they're in this harness? Essentially, it's just finding a position that's comfortable. So just reminding them they can still do everything they did before. They may just need more support or a different way to hold their baby, so it's comfortable for both them and their child. Dr. Stroop talked a little bit about this already, but one of the biggest things we tell families and you guys in your clinics to look out for is a femoral nerve palsy. So as he had mentioned, we really want to see that baby kicking at the knee. So when we see families for that first visit and we're putting them in the harness, we remind them of this and kind of say to them, every time you go to change a diaper, just check that that baby is kicking at the knee, right? Tickle their foot, kind of get them stimulated, and if you really cannot get them to kick at the knee or their leg kind of looks limp and it's not moving, that harness should just come off. Usually what's happened is they've gone through a little growth spurt and we haven't seen them back, and the knees have gotten and the hips have gotten flexed to greater than 90 and kind of look towards an M shape. So if you pull down on their knees, you really can't get that tabletop 90-degree position. That, essentially once that harness is removed, almost all of these cases resolve. When we look at the literature, we see that the incidence of this is somewhere between 2 to 10%, although we don't know if it's reported all the time. But we know that just simply removing the harness, letting the nerve recover is the best treatment, and then actually restarting the Pavlik rather than abandoning it altogether. And just reminding them this is temporary, it will resolve, and they can still go on with this treatment. Another risk we see is osteonecrosis. So as we have mentioned before, essentially we're losing some blood supply to that femoral head. And we see incidence similar between 1 and 11%. And we know that there are certain risk factors that make this more likely, the biggest one being severity of hip dysplasia. So these dislocated hips on that end of the spectrum are more likely to develop this. Usually we see that this is can be a result of improper harness fit or hyperabduction in the brace. And unfortunately, this can lead to long-term permanent changes in that femoral head that can need surgical indication or surgical treatment later on. For you guys and for parents, we just let them know the biggest thing to prevent this is just detecting it early and making sure the harness is fitting them the way it was set initially and it's properly fitting. In this picture, you're just kind of seeing an x-ray of how that has developed over time in a patient that had developed osteonecrosis. They're referring to it as AVN here. And they've looked in, they can see that patients who fail their Pavlik harness, so as Dr. Sroop mentioned, when we put patients, especially those with dislocated hips, into a harness and it reduces, we do see a higher incidence of this happening in patients who initially were on that end of the spectrum where their dysplasia was more severe, and this can be a predictor for this developing in patients. The last complication is Pavlik harness disease. So in a similar way, when we see failure of the Pavlik harness, we can see some posterior lateral remodeling of the acetabulum in patients that have Pavlik harness disease. Essentially, they've been in this Pavlik harness and they're not responding to this. Most of these patients have dislocated hips, and this hip is not reducing well into the acetabulum. And the reason we care about this is because these patients often will go on to need a closed or open reduction later, and it can make that intervention harder later down the road. This is the biggest reason why, if we see a patient and we have them in a Pavlik and we get an ultrasound at 2 weeks and at 4 weeks and we're really not seeing any change or improvement, we abandon the harness and we try something else. And one of those things we use is the Rhino abduction brace that Dr. Sroop had mentioned. So abduction bracing, this girl looks very happy and she's standing up in her brace. So these typically are used in kids that are older. We typically don't use it as much during the day, so most of these patients use it for nights and nap time when they're asleep. These older kids are going through a lot of developmental stages, so we want them to be able to do those things during the day, and the brace is typically, but not always, used when they're sleeping. It's used usually around 6 months and can be up to 2 years, although some patients will tolerate it longer, especially if they've already gotten used to it, and we started at a really young age. And when we talk about taking care of patients in this brace, it's a little simpler than the Pavlik. It has less straps. It's essentially from your waist down. There's a strap around the baby's or the kid's waist, and then 2 straps, one on each leg. It's a smooth foam and a smooth plastic, so it's much easier to clean than the Pavlik that is cloth. And same thing, just kind of spot cleaning only. The biggest thing we run into with patients who are in these is we don't see them as often as we are checking on our Pavlik harness patients. So we see them sometimes 4 to 6 months apart from each other. And just making sure if they have this brace in their home and they feel like it's not fitting properly, just to come back to our clinic so we can get them the next size up if that kid has grown a lot. In terms of counseling overall for both the Pavlik and the abduction brace, I think the biggest takeaway that I've learned from treating these families is that this first visit, when they're starting this treatment, is very overwhelming and often very emotional. And you may see some of that if they're coming to you for their well baby checks and they've just been started in this harness. So I think the biggest thing I remind families is that just being consistent is probably the best thing, so that both the baby and you as parents and anyone who's caregiving for this child can get used to this new routine. They have a brand new baby, sometimes it's their first child, and it's a lot for them to take in that first visit. And especially also patients who end up in our Rhino braces that are older. A lot of families worry because those kids have stronger opinions about things. They can learn to take off the brace and it becomes a little bit of a fight. And I think some parents give up. But I've found that parents who just stay consistent do really well. Some parents will say to us, we get the brace out and we get our pajamas out and we're getting ready, and they just see that brace and they know it's bedtime, right? And those are the families that do really well. So just reminding them it's temporary, it's not forever, and just to be consistent so that they can have success with this treatment, which hopefully will prevent a bigger surgery or more treatment later down the road. A lot of families will ask about tummy time. So can I still do tummy time? Do I have to take off this brace or this harness to do it? And the answer is no. They can absolutely do tummy time with it on. Some kids, even not in a brace, hate tummy time when they're little. And so just reminding them to use different strategies to extend their tolerance. They can roll up a blanket, put it under their chest, and they can usually last a little bit longer. In our families who spend an hour out of the brace or in the weaning phase and are not in that Pavlik harness for a full day, they can certainly use that time as well for letting them practice rolling and all the things they're starting to show signs of doing. In that regard, some parents will ask, if they're in this brace or this harness all the time, is it going to slow them down? Are they going to not reach the milestones like my other child, or not on time? And I think just reminding them that there really is no evidence that kids don't meet those milestones or are delayed who are undergoing these treatments. And a lot of families will relay, as soon as we stopped the Pavlik, they really started rolling, right? They will catch up, they will meet those milestones, and just reassuring them of that. We give patients like 2 big resources when they come to us for their visit. The first is hipdysplasia.org. This is like a very comprehensive website that has literally everything you'd ever want to know about taking care of a baby with hip dysplasia. It has like down from like the sleep sack, what you use, the carriers you can use with the Pavlik, and it really even shows like videos of how to change diapers, how to put the Pavlik on. So it's a really, really comprehensive resource for families. Orthokids.org is more informational, but has a lot of information about hip dysplasia and the spectrum of treatments that we use in pediatric ortho. And that's it. Thank you.